Okay, so today we're going to be doing a Foley catheter on a male. To start with, I'm going to perform hand hygiene, verify that the patient is who they say they are using two verifying methods, which is birthday and name. And then I'm going to check for that Foley catheter order. I'm going to ask the patient whether or not they have a allergy to iodine or shellfish, because both of those things are within the betadine that we use to swab. And then after I do that, I'm going to explain the procedure to the patient. So you're going to have a Foley catheter placed. You have the right to say no. However, there's going to be some slight discomfort, but I promise I'm good at what I do, and I'll make it as easy as possible. Okay, if you have any excruciating pain throughout the procedure, just let me know and we can stop. Okay, so then I would gather my supplies. So I have my Foley catheter kit and my sterile gloves separate on a bedside table. I've raised the bed to a comfortable working height with the side rail on the opposite side up. And then first I'm going to expose my patient, don those gloves, and perform peri-care, front to back. And then I'm going to dispose of my gloves, perform hand hygiene one more time, and then we'll start the catheter procedure. So to start with, I'm going to take my catheter out of my bag, out of the external compartment, and then opening the catheter away from me. And then the sides, and then finally towards me. Making sure to pinch and have that 2-inch border. And then I'm going to pinch inside, pull out this little chuck sheet, and then position it under the patient. Making sure to keep everything out of my 2-inch border for my sterile field. And then again, I have wipes and hand sanitizer. I will not need these, so I will dispose of those. And then I have the perforated sheet. I will not need it. I'll dispose of it as well. So at this point, we're going to don sterile gloves. So I'm going to open my sterile glove package. And then folding underneath the cuff, pulling them out, pinching it so it stays down, and then pulling one glove out, keeping the fingertips down, and sliding the hand in, holding only by the cuff. And then grab the second one with the scoop method, slide my hand in, making sure to keep my fingers on the top of my arm for a sterile technique. And then I'll remain in my tent praying position whenever I'm not working. And at this time, we'll start by setting everything up. So I will check my catheter for patency. So to do that, we're just attaching our NS syringe and then checking for patency, so that balloon blowing up, and keep it attached. And then I'm going to open up my lubrication, set that aside, and I like to go ahead and remove this blue sheath and then toss it away from my sterile field, making sure my hands are above my waist at all times. And then I like to stick my catheter in my lube and set that aside. Okay, at this point, I would take my iodine swabs and then grabbing the penis with my non-dominant hand, I would swab from the meatus outward in a circular motion. And then this hand becomes contaminated, the one grasping the penis, retracting the foreskin if needed. Okay. And at this point, I'm going to tell the patient that I'm going to use the therapeutic communication techniques and tell them to breathe deeply, it'll be okay, and then you're going to feel some slight discomfort, and then I'm going to push it in, until I have urine output. So at this point I have urine output. So I'm gonna hold on to my catheter, inflate the balloon with my contaminated hand, and then pull back for resistance. It is resistant, so then I'm gonna push in 2 more centimeters. One thing to focus on is that you need, for a male patient, to insert the catheter roughly 17 centimeters into the bladder. Okay, and then at this point, you're gonna apply your stat lock using your skin prep, and then attach it, and then you'll attach it to the Y, making sure that it doesn't pull on the catheter. And you would take your bag, hang it on the side of the bed, below waist level, and on a fixed object, so the bed frame, for instance. I would wipe off my iodine, provide peri-care if need be, and then clean up my container. And then at this point, I would collect my urine sample from the bag, which is still sterile because it hasn't been opened yet. Collect my sterile urine sample. I would provide privacy for the patient and place call light within reach, lower the bed to a safe height, which is the lowest position, put up both side rails, again, make sure the patient's comfortable, and then I would document my findings. So findings include urine consistency, urine color, urine volume, the odor, and any hematuria as well. So, and then dispose of my stuff, perform hand hygiene,